how many TT do you perform a year? Do you use a specific technique? What's the worst complication you've encountered? Oh, do I have to say? Oh, you're making me remember these things. Oh dear. Tough job being a surgeon. You carry these things around. You don't forget these things, you know. Okay. How many tummy tucks do you perform a year? This is leading on to my other thing that I was going to talk about. But anyway, I perform maybe 20 a year, something like that. Because I'm going to talk in a minute about this, but should I talk about it now? No, I'll talk about it in a minute. So I talk about, so let's say about 20 a year. Do you use a specific technique? Yes, I do. I use a specific technique. Obviously, there are different types of tummy tuck. I perform all types: full tummy tuck, mini tummy tuck, fleur-de-lis, reverse abdominoplasty, circumferential. So there's different types. So different techniques. I don't know if there are sort of different ways that you can close the tummy, different sorts of stitches. I use quilting sutures and I use drains. We're all trying to move away from drains now. There was a fashion for glue. A lot of people use glue and no drain. I never embraced that personally. I prefer the quilting sutures, which is actually stitching it down. And I still use drains, but I don't get much in the drains. So I'm now thinking, oh, should we not use drains? And we're probably close to that. I would say, Debbie, I'm doing less and less surgery now because I'm building a business and what have you. So I am doing less and less, but I'm putting together a team at the clinic, and we're going to have a way that we do stuff, and we'll work out what the best way to do things is. Currently, where we are, we're at the quilting sutures, still use drains, but as I say, trying to move away from that. But it's just the seroma that I worry about. So I don't know if that's what you mean by specific technique. There's lots of different things you can do within a tummy tuck. So the way you fix the belly button in place, believe it or not, there are papers written on that. I've written a paper on that, and I use the technique that I've written about. I use it so the belly button sits in a hollow and with a superior hood. Some people use some people use barbed sutures, some people use drains. Some people use dissolvable staples. As I say, I don't use barbed sutures, dissolvable sutures, and I can talk about the pros and cons if you want to know why. The problem is whenever lots of people do different things, there's no one good way of doing it. And I'm not saying the surgeons who do it are wrong, and they wouldn't say I'm wrong. It's just different ways of, well, I hope they wouldn't. There's just different ways of doing things. So so I developed and got a technique which works, and that's what I do, and that's what we talk about at the clinic. The worst complication you've encountered, Debbie, I've got to tell you, any surgeon that tells you they haven't got any complications is either lying or doesn't operate. So I have had complications, Debbie. In recent years, I've had problems like I had a hematoma. Maybe it was last year or the year before. You don't get that often. Seroma a couple of years ago. These are relatively easy to fix problems. The worst, but you can get big problems. You can get big problems when you're doing plastic surgery, when you're doing tightening procedures, things like mastopexy, breast reductions, tummy tucks. And the worst problem I had, which I still vividly remember, is a problem when I was working at the City Hospital in Birmingham in the NHS, and I did a tummy tuck. This is going back quite some time when tummy tucks were still allowed to be done on the NHS. And the patient, the wound dehisced, the wound broke down, sort of opened up, and it was a real struggle. We needed dressing, which is a vacuum assisted dressing, for a long time. I've got to say the patient was a smoker. Now we do smokers, and I try and have is conciliatory the right word? We try and get together, and I say to people, if you're smoking and you can't stop smoking, don't have a tummy tuck, because it's just not worth it. The only big complications I've ever seen have been in smokers. That doesn't mean all smokers get complications, but it does mean that if you smoke, you got a higher risk of getting complications, because every time you smoke, you reduce the blood supply to the skin. And when you're closing things under tension, whether that be a breast reduction, tummy tuck, facelift, mastopexy, you're closing wounds under tension, that skin is tight. And if it doesn't heal up, it opens up, and it's a real problem. So I did that happen to me. As I say, it was in the NHS in the city hospital, and I can vividly remember coming in the morning and seeing this patient sitting outside with a cigarette, with her vac machine and this dressing on her tummy, and she was sitting in the smoking shelter outside having a cigarette. You know, she said she didn't smoke, or she said she'd given up smoking. She obviously hadn't. We talked about it, and we talked about whether we test people. They're talking about testing. I mean, it doesn't sit very easily that when you're having a conversation with a patient, you don't want to sort of start testing them to see whether they're smoking or not. And there's all sorts of false positives. If someone in the family smokes, it might come up positive, and it's a bit awkward if it comes up positive. You say you stop smoking, we do a test, and we say, look, that tester says you are still smoking. It gets awkward, so we don't test people. But I think that, you know, I can understand the argument for people wanting to test, because it is a nightmare when you do operate on smokers. So this lady, the wound opened up, and she had a vac dressing for a long time. She had to have a skin graft, and then later on I managed to excise the skin graft, and it actually looks fine now, but it took a year or more to get over it all, and it was really painful for me and painful for her, and she was in and out of hospital, and it was a bad complication. You can get bad complications with tummy tucks and all of these breast body contouring operations. You can get bad complications. They are out there. I don't need to tell you that. You just search on the internet, they're all there. Now, they're not common. They're not common. You know, this is going back, you know, 10 years or so. So, you know, it's not a common thing, but it's out there. And certainly as a surgeon, when you get a problem like that, you don't forget it, and it stays with you, and it's, you know, really tough times. So yeah, there is risk with surgery. So when I say that, Anna, do you have to have drains? It's Gemma. Sorry for the questions. Don't say sorry. Can't you see? I've got no more questions. I've got one thing I want to talk about actually. But Gemma, do you have to have drains? If so, how long? For tummy tuck, yes, we still use drains. So the drains, the first thing to say is you don't go home with the drains, because one thing that people talk about is that if you don't use drains, you reduce the hospital stay, you make the hospital stay less. But usually it's a 2-night stay, sometimes 1 night, rarely 1 night, sometimes 3. I would say average is 2-night stay. But to be honest with you, a lot of people want to have a sort of 2-night stay just to get back on their feet and walking around. So even if you didn't use drains, it often doesn't reduce the hospital stay. The main problem with drains is they're uncomfortable being removed. I think anyone will tell you that. So patients don't like them. And I totally understand that, but they're good to sort of just close the space. So yeah, so they're normally in until you go home. So you'll have the surgery on a certain day. Have a look day 1. Usually day 1, the first day after surgery, there's usually not a great deal in the drains. Well, there may or may not be a great deal in the drains. But then what we do is we try and get you up and walking. So we try and get you up and walking straight away. So that day, sometimes it drains a little bit more because you're up and walking. So that's why it's unusual to take them out on the first day post-op. And then the second day post-op, they will often come out on the second day post-op, and then you can go home. Sometimes it's the third day if there's too much in the drains, or if you're not feeling up to it, it might be 3 days in hospital. But it's usually sort of two nights in hospital is average. So 2 nights in hospital is sort of 3 days, isn't it? 3 nights is 4 days. Anyway, 2 nights in hospital is usual for a tummy tuck, but sometimes 3. Hi.